The Milton Keynes Mental Health Alliance has been running for nearly 4 years. It's got nearly 40 members now, and they're made up of voluntary and community sector organisations that are really interested in improving the mental health for people living in Milton Keynes. The Alliance is funded by Central North West London Health Trust and also Public Health, and we at Community Action MK support and facilitate it. Over the years, it's run several transformative projects looking to address health inequalities across a range of areas, and the groups are really able to bring lived experience and unique expertise into the project so that it can have a really big impact. And the great thing about the Alliance is it enables those groups to come and work together. Jane Linns is project coordinator for the charity Talent Unlimited. Talent Unlimited is an organisation supporting autistic individuals in Milton Keynes. Jane has successfully completed 2 health inequalities projects since joining the Mental Health Alliance.
I managed to get the funding to set up and lead on MK Autism, a website, which is the current project. Without the funding, the project would not have been launched. It's several £1,000s to get the site designed and up and running.
My name's Ben Hayworth. I'm from Arts for Health, Milton Keynes. Arts for Health Milton Keynes is best known for its management of the extensive art collection at Milton Keynes University Hospital. But we also have a substantial community programme that does arts on prescription for adults and young people, and a variety of specialised creative health courses. We have had several projects funded by the Mental Health Alliance over the past couple of years. Most recently, we've been working in the health inequalities space, and we've been able to bring in new volunteers to help us out at Milton Keynes University Hospital in a project that we call the Creative Courtyards. This is an outdoor project where men, specifically men, because that's who this project is aimed at, have been able to come in and use some of their gardening skills to work up these slightly unattractive brown earth spaces on the hospital site and to create some much more interesting and hopefully long-lasting and sustainable garden spaces. We've had loads of volunteers come down and it's been a real success.
DAFS, which stands for Drug and Alcohol Family Support Service in Milton Keynes, is a charity run by Valerie Forsey and Lynn Fox. Their organisation offers a safe space for families to come together and share their lived experience.
As a result of being fortunate enough to be successful in getting the funding from the Mental Health Alliance for our project, we have been able to put on a trauma workshop. We've been able to purchase a website platform and the hosting that goes with that. We've been able to get mobile phones for all of our facilitators, all our volunteers. We've put training on for our trustees, so we're all fairly new in the role. We've put on a couple of wellbeing events actually. Every month we now run a crafting session. Been really successful.
Rob is Activities Coordinator at YMCA Milton Keynes, an organisation which supports young people in Milton Keynes with everything from housing to socialising. He's been running a wide range of clubs, sporting activities and days out with the young people involved in the YMCA through the Health Inequalities Project.
The funding has helped us give a more varied programme and has helped us reach more and more residents. So the specific groups it's helped reach are young people seeking asylum, people who have experienced homelessness and care leavers as well.
The Alliance groups have recently been focusing on health inequality priorities such as black and minoritised communities and also middle-aged men. They've also been looking at social factors such as relationship breakdown, social isolation, living in regen areas and also the cost of living crisis and how all these things can impact people's mental health. Odette Mould is CEO of Harry's Rainbow, Milton Keynes' only charity supporting bereaved children.
What we need to make sure we're doing better is connecting with our whole community of Milton Keynes, which is so diverse. Sometimes the ways in which we raise awareness may not reach some of those communities, and so what the Mental Health Alliance is enabling us to do by funding us so we can specifically target certain groups, we can then meet with those certain groups and tell them what services we offer and also find out about how we can adapt those services so they are more accessible. With some of the funding, we've been able to visit other organisations, and in particular recently we visited a summer holiday club, and we created memory boxes with the children and painted pebbles and stones. Without the funding, it would have been difficult for us to be able to access the organisation that we'd met and are now building relationships with, but also be able to purchase and find the time and resource to be able to offer that activity.
Jay Virgo, Communications and Engagement Manager at Q Alliance, Milton Keynes' LGBTQ+ charity, has been running a health inequalities project spanning several of the priority areas.
So the most benefit we've gained from this is not just kind of like the networking and working with other organisations, but the main thing for us is seeing how many people we're actually able to impact. When I first started 3 years ago now, I had 3 adults to start with, and that has now progressed to like anything. I think I've got like roughly about 140 adults now. It's really had actually quite a profound impact on all of our other services. So because we've got more service users, we're getting more training bookings, we're getting more people interested in volunteering, we're getting more people interested in fundraising. It would be surprising like how much you could see benefit comes from that piece of funding. Like it has had such a huge profound effect on us as an organisation.
My name is Marilyn Smith. I'm the Chief Executive for Milton Keynes Dons Sports and Education Trust. We're the charitable part of MK Dons Football Club, but we work with communities, so we're the outward facing part of the football club. We were involved in the Mental Health Alliance project by providing support for middle-aged males and also for Black and Asian minority communities across the city. The aim of trying to increase participation in sports and physical activity and reduce sedentary behaviour. One of the things that we were keen to do is make sure that people that don't traditionally access physical activity were involved in our programmes. So we targeted places like Wolverton, Bletchley and the communities with highest levels of deprivation across the city. And also then to try and keep them within sports going forward as well. Without that funding, that wouldn't have been possible.
The Mental Health Alliance meets every month, usually online, with an annual in-person meeting too. Members have the opportunity to network, learn about new developments and opportunities in the Milton Keynes mental health arena, and find out more about funding too.
Being part of the Mental Health Alliance is really, really useful. I'm a networker by nature, and it has really enabled me to give the autism voice, but to make contact with lots of people who I wouldn't have met before.
There's been loads of different events where we've had different guest speakers from other organisations and charities, people from kind of CNWL, the ICB, etc. have kind of come in and actually spoke to us face to face, which has been really valuable for us as a charity to understand how these systems work.
It's just the platform that people need to be able to understand what is out there, so that we can tap into other organisations, we can link up with them, do the partnership work, but we can also refer our families certainly into the organisations that we are becoming aware of each time that we meet with the Mental Health Alliance.
We've seen through the conversations this has helped us to develop work with dementia and stroke organisations in Milton Keynes, but also we've been able to provide physical activity to other voluntary sector organisations as well.
It's absolutely amazing to be able to come into a space like the Mental Health Alliance and meet so many other stakeholders with shared interests. We've actually done a number of partnership projects over the last couple of years with people like Mind, the Citizens Advice Bureau and Harry's Rainbow.
Being involved in the meetings that the Mental Health Alliance run was really beneficial. We got to meet organisations that support mental health within the Milton Keynes community, but also learn of what funding was available for us to access. I don't believe I would have learned about the funding that was available from various areas if it wasn't for the Mental Health Alliance.
I really hope the Mental Health Alliance will continue. I'm sure over the years there will be changes, but it's really vital to Milton Keynes, to community groups, to charities in Milton Keynes, to really pull people together.
Without the Mental Health Alliance, who act as a conduit between all the organisations, I do think with the pressure that we're under, I feel that it would be much harder for us to try and create those opportunities ourselves.
I think they've got such a strong model now that has been kind of like filtered through and tested and trialled so much that they've got a really kind of like strong example of what good funding allocation looks like, and I'd love to see them get given more opportunities to do that.
I very much hope that in the future we can continue to develop the relationships that we've already built up by attending the Mental Health Alliance between different organisations in Milton Keynes. And I'd really like to see some collaborative work come to fruition, perhaps with 1, 2, 3, 4, or even more than that, partners coming together with shared goals, shared aspirations and shared ambition, and hopefully a big impact on improving mental health in the community.